Hi, this is Andrea Kane, and I'm here with you for HIT 452 Statistics and Data Analysis. We are now on week 7, and for week 7, we are looking at secondary data sources and healthcare statistics, specifically vital statistics. Our textbook really doesn't cover these things very well, so I'm choosing to go back to the HIT 330 textbook, Health Information Management Technology and Applied Approach 6th edition, and I'm going to be covering chapter 7 and part of chapter 14. And that's what our lecture videos are going to be for week 7. If you look at your syllabus, you can see we're going to be working on unit objectives 9.9.1 through 9.9.5. Excuse me, and the first part of this is going to be secondary data sources. So here's the background information that you need to have on that. Databases are used to see trends in data. There are two different types of registries. There's usually a facility-specific registry and a population-based registry. When you are looking at roles in managing secondary records and databases, the first thing you need to do is look at how you're establishing databases. You want to determine what the content of the database is going to be, make sure it is compliant with laws, regulations, and accreditation standards, make sure that it has a current data dictionary, and determine who is going to be responsible for data stewardship. So now let's move into primary and secondary data sources. A primary data source is patient health information directly from the medical record. A secondary data source is information that is pulled from that primary data source and used. So secondary data sources are typically databases where information has been pulled from the medical record and put into there. There are ways to classify data such as patient identifiable data and aggregate data. Secondary data are usually aggregate. They've been pulled from a number of sources. What is the purpose of secondary data sources and who are the users of that information? There are 4 major purposes: quality, performance, and patient safety, research, population health, and administration. And those are also users of it, obviously. You can have internal users within the organization and external users outside of the organization. The facility-specific indexes that are kept are disease, operation, and physician. Those are types of secondary data sources that are kept in the facility specific to that facility. And again, disease, which would be diagnosis and comorbidity complications, operations or procedures, and then physician. Some types of secondary data sources when you talk about registries are disease, cancer, trauma, birth defects, diabetes, implant, transplant, and immunization. Those are very common types of registries or secondary data sources. When you talk about cancer registries, these are specific to obviously cancer. They look at case definition, case finding, they have an accession registry, and each one has an accession number. Each case that's in there has an accession number. It looks at the staging and grading of the cancer as well as the patient's longevity and several other areas. Cancer registries report cancer cases. They have to provide an annual report. They do quality assessment. They help with research, and then they do follow-up. Again, they follow that patient until the patient dies to look at survival, to look at treatments, those types of things. Cancer registries are certified by the American College of Surgeons. So you'll hear that's who comes out to survey a cancer registry in a hospital. There are also some other organizations you may want to be aware of, like the North American Association of Central Cancer Registries and Centers for Disease Control and Prevention, the CDC. There is a group called the National Cancer Registrars Association, and they hold the certification. People can become a certified tumor registrar or a CTR. Trauma registries. These involve trauma injury, case definition, case finding, abbreviated injury scale, injury severity score. They have to produce an annual report. Many or most do perform some type of follow-up. It may not be through patient death, but they do some type of follow-up. Birth defect registry looks at newborns that may have a birth defect. They have case definition and case finding, and they also usually do follow the child at least for a period of time. Diabetes registry, this looks at all patients with diabetes mellitus, case definition, case finding, and follow-up. And again, this is usually facility specific, although there can be some national registries. Implant registries, these look at specific implants such as pacemakers, heart valves. It can be hip replacement joints, knee replacement joints. Those are all implants. They have case definition, case finding. They also do reporting to the FDA, and they also keep track of any recalls. The FDA is Food and Drug Administration. Transplant registries, these look at organ transplants. They track patients who need a transplant as well as patients who have had transplants. And again, they cover follow-up as well, annual reports, different things like that. Immunization registries are usually on a statewide basis. They track immunizations from multiple providers and often remind parents of immunization. There are other registries that can be developed for other diseases and conditions such as cardiovascular diseases or gastroenterology conditions, such as Crohn's disease, that type of thing. Also, administrative registries may be created. A National Provider Identifier Registry is a good example of that. There are many types of healthcare databases. There's one called the Medicare Provider Analysis and Review, and that looks at claims data from acute care hospitals and skilled nursing facilities on Medicare patients. And it contains a lot of the information that you see here on the screen. The National Practitioner Data Bank is a database of medical malpractice payments, adverse licensure actions, and certain professional review actions. There's required reporting, and there's also required access to the data bank that you have to do as part of the credentialing process. Failure to report when you have to results in penalties to the organization. There are also national, state, and county public health databases where they're looking at surveillance of health for a specific population. They do monitoring, which can include incidence and prevalence of disease, possible high-risk populations, survival statistics, and trends over time. Data is collected by interview, physical exams, and health records. With COVID, you'll see a lot more with this. The National Healthcare Survey is a public health survey. It's made up of several surveys, and it contains data from all of those. And then there are other healthcare databases, whether those are national or state. They can be administrative in nature. They can be public health in nature, that type of thing. And this just gives you a few additional ones. So vital statistics. Vital statistics collect data on births, deaths, fetal deaths, marriages, and divorce. These are collected by state. So each state has its own rules on vital statistics. There are some overarching national requirements that each state has to collect and report because the information is shared with the National Center for Health Statistics, but how they do it varies a little bit from state to state. Vital statistic information is also linked to birth and infant death data set information. There's some information here about clinical trials. This is a research project in which new treatments and tests are investigated. They have specific protocols. You can go to clinicaltrials.gov and see information about the purpose of the study, recruiting status, criteria for participation, location of trial, and contact information. And then there's the health services research databases. These have information for research concerning healthcare delivery system. If you haven't already, we'll definitely, as you go through the program, talk about ARC or AHRQ, Agency for Healthcare Research and Quality, and they have healthcare cost and utilization projects. There's also the National Library of Medicine. You may have heard of Medline, where you can go online and look at medical literature. And then there's UMLS. This is a unified medical language system that links between different information systems. And there are health information exchanges. These take patient-specific data that can be used for healthcare, for patient care, and make it available to healthcare providers. There's data for performance measurement through core measures or core performance measures. They're required for Joint Commission, CMS, and some health plans. All healthcare organizations, especially acute care hospitals, have to report these core measures, and then they're utilized for review on performance. I'm going to skip through here about HIM roles, and that is the end of Chapter 7. So hopefully the information on secondary data sources and vital statistics is something that will help you as you go through your week. I will be back next with a really quick overview of that section of Chapter 14 that has to do with vital statistics.